Linda familia na marafiki dhidi ya magonjwa.
The UHC coverage journey is on. NHIF is working under the guidance of the Ministry of Health in the UHC Step-up, which presents an opportunity to secure Kenyans access to quality health services without suffering financial hardship. So take the bold step today and safeguard your families by enrolling to NHIF to ensure health for all.
Now, realization of the universal health coverage for this administration is vital and key for the many residents who are seeking affordable and accessible health services across the country. Joining us this particular afternoon is none other than the Ministry of Health Cabinet Secretary, Mutahi Kagwe. Waziri, karibu sana.
Thank you very much.
Now, thank you so much, Waziri. My first question to you will be, it's in a broad sense, but in a light kind of way. What does the universal health coverage intends to do for the millions of Kenyans who are watching you right now?
Thank you. Thank you very much. And thank you for this opportunity to explain what is perhaps a little misunderstood.
Yes.
First and foremost, let me say that the universal health coverage is a dream of all Kenyans that was essentially established and dreamt first by President Uhuru Kenyatta when he created his 4 agendas that he wanted to succeed in as part of his legacy. And the UHC, or Universal Health Coverage, is an all-encompassing improvement in terms of healthcare in Kenya. It is not a happening. It is not an event. It is not even something that is going to happen in a day. It is something that is going to be the continuing management system, the continuing improvement system for healthcare in Kenya. And the encompassing issues, as far as the UHC is concerned, are essentially 3 or 4. The first one has to do with the access to health. Are Kenyans able to access a health facility? Are they able to go to a hospital? Are they able to go to a clinic? Is a community health worker able to go and see a pregnant lady at her home in a hospital? Are the malaria community health workers able to go and monitor and see what is going on there? If there is an outbreak or epidemic, are we able to respond instantly and quickly? If a person has got cancer, are they able to be treated in a hospital in Kenya? That is the issue of access to health. In other words, can a citizen of this republic come face to face with health services when they need them? The second thing about health coverage is a question of the standard of healthcare. It is okay that I might be able to go to a hospital, but who do I find there? How am I treated when I get there? Am I going to find the medicines that I'm going to look for when I get there? Am I going to find an X-ray machine that is functioning so that I can get an X-ray, X-rayed? That is the issue of the standard of the health facilities that we have accessed. And finally is the issue of affordable. You know, I have got a nice hospital I've gone to. I have got a nice doctor that I have seen. A nice nurse is looking after me. A good lab technician has taken my blood and is able to diagnose it. Now that they know what my problem is, am I able to afford it? That is a very important part of the health, of the universal health coverage. And therefore, the introduction, the inputting of the National Health Insurance Fund comes in to answer that last question of the issue of affordability. If I go to a hospital and I'm unwell, if I need dialysis, am I able to go to a dialysis center and be treated and not pay cash out of my pocket? And if I need chemotherapy because I've got cancer, am I able to go to a hospital and get chemo without going back to my pocket? Essentially, the idea is that we do not impoverish Kenyans just because they are sick. When somebody is unwell, they are already disadvantaged. At least physically, they are disadvantaged. When you then put them through another disadvantage of financial stress, then, you know, we begin to question our ability to take care of our citizen. So the entire aspect, the President Kenyatta's intention is to create this atmosphere, this country where people know that if they are sick, they not become poor. If they are sick, they can get help. If they are sick, they'll be taken care of. That is the essence of universal health coverage.
Now, given, Waziri, that you have been leading this vital ministry, especially amidst the pandemic, what would you say the journey has been, not for you, but for the many people who have been working under the UHC program so far?
Tough. Tough is a good word to use.
Okay.
You know, it has not been easy. And I think that anybody professing otherwise, you know, would be lying. We are human beings. We come under stress. The challenges are many. And never forget that the difference between a challenge in health and a challenge in another system or another agency is that health is extremely personal. It's extremely personal and urgent. It is always very personal and very urgent, because it is possible for you to explain to somebody and say to them, we are going to build a road for you next year, okay? Or we are going to build new classrooms next year. Or it is, you know, whatever you are talking about, it is possible to do it sometime next year. When I'm suffering from malaria, you cannot start telling me a story about how you are going to take care of me next year, or how you are going to buy medicine for me next week, or that I can't get an injection right now. You know, so the urgency of healthcare, the personalized nature of healthcare is what causes a big challenge, whoever and whatever time. Now, when you add the issue of an unknown epidemic, a virus that is new completely to the whole world, there is no expertise in managing it. It's a question of whether you are able to keep your calm during a very heavy storm. And so I would say that within the Ministry of Health, we have got extremely calm individuals who have done a brilliant job. You know, my job has just been to be the pilot of the ship.
Okay.
But there are so many other people working in here and who have done a fantastic job. And of course, at the end of the day, the entire leadership, because managing epidemics is not a one ministry affair. It is always a multi-agency affair. When you say that when you say there is a curfew, the Ministry of Health does not have a single policeman. You know, you declare a curfew, but curfew is then managed and executed by Interior. You know, so that is the work of Interior, and it's a difficult job as well. Then, you know, all other multi-agencies are involved in the whole thing. We want local manufacturing or some of those things. That is the Ministry of Industrialization, you know, and so on and so forth. Then you are dealing with a big challenge as far as acquisition of vaccines is concerned. So you have to engage the Ministry of Foreign Affairs. So this whole thing was done under the leadership of the President, because by the end of the day, he is the one who leads all those agencies. But for me, it's really just to say thank you. I would never have imagined that I would be here at a time like now. But now that I am, I can honestly say, without any shadow of doubt in my mind, that Kenya has got an extremely qualified health workforce.
Okay. And given that the President, we saw in his earlier speech earlier this year, he was stressing on the importance of the realization of this program and what it will mean for the many people who are out there. So the question will be, Waziri, since then the President spoke, what has the ministry been doing behind the scenes? Because we don't see normally what you do behind the scenes. So what has the ministry been doing?
You see, this is a situation, and that's why I'm saying, you know, this whole thing is misunderstood.
Yes.
You see, when you say what you have been doing, every day we announce something. For example, in the same Mombasa setting, we are going to be in launching UHC.
Yes.
In the morning, we have got an international consultative conference on curriculum, the curriculum conference. You see, that curriculum conference is part of UHC. It is item 1, item 2, the one I talked about, the standard of healthcare. That's why we have brought together all people involved in the area of healthcare, professors from universities, private sector trainers, you know, laboratory technician colleges and tertiary sector, to bring them together to one setting to discuss the quality of our health worker. That is part of UHC. So until you begin to see the forest, all right, if you continue seeing a tree, then you'll never understand UHC. But if you see the forest, and then in the forest, you see every other tree that makes up the forest, then you begin to see what we have been doing. The build-up that has been there, the MES project, to put machines in all hospitals. That is part of standards. It's part of ensuring what we have been doing in Kenyatta University Hospital, teaching an Ifaro. The cancer center, that's the cancer center we have been building. If you go to Mombasa, you see a cath lab where they are able to do surgery on your heart without necessarily cutting you up. That's part of UHC. Everything we are doing here, the training we are doing here, the many negotiations we have had with the private sector within NHIF, the discussions we are having to bring down the cost of healthcare, that is part of UHC. The policy framework that we have developed various policies, including the UHC policy. All that is part of the universal health coverage. When you hear that we have developed all sorts of hospitals, when you hear we have got 19 brand new hospitals in Nairobi, we are building another 50 hospitals, that is access, all right? You want to make sure that if you are in the remotest part of Kenya, you can be able to walk to at least a level 1, a level 2 or a level 3 hospital. That is access. That is universal health coverage. So it is not a single thing. It is everything that we do.
Okay. And given that, of course, we are coming to the end of this particular conversation, would you say this is the legacy, not just for President Uhuru Kenyatta, but for this administration as a whole?
I would certainly agree with that. I would certainly say that, you know, what has happened in Kenya over the period where President Kenyatta has been president supersedes what had happened in all the years prior to independence up to his taking over. When you think about, for example, the capacity for dialysis, and you talk to people who need dialysis, and you know how unavailable, you know, that if you needed dialysis, it was almost a sentence to death. You have to go to Kenyatta National Hospital, one or two other very expensive private sector hospitals. But today, you can go to very many government hospitals, you know, get paid, and they pay, and the NHIF will pay for you to get dialysis in full. So when you look at those things, and when you look at the fact that, for example, 2 years ago, we had 8 infectious ICU beds in this country. We have got about 600 2 years ago. When you think about the possibility of constructing some 19 hospitals and reviving the entire healthcare system in a city, it is almost impossible to imagine. So I think that long after President Kenyatta has left office, I think after that, people will really begin to appreciate what it is he has done in the health sector.
And finally, Waziri, given that we have to let you go, we're talking about the importance of this launch, and so many people looking forward to what will happen in Mombasa County. What should we expect out of Mombasa?
Well, you know, again, you know, a launch is essentially a symbol. If you simply have an activity to symbolize that we have now started entrenching ourselves in this journey. But the most symbolic one will be the beginning of the registration of 1 million people who are going to be paid for, whose membership to NHIF is paid for by the government. Because I talked about affordable healthcare and the importance of people having insurance in order to access health. But remember, there are Kenyans who may not be able to buy insurance for themselves. And the method of UHC, as we have established now, is that an individual like that will be supported by the government. The government will pay to the national health insurance fund, and that individual gets covered plus their families. That is how they'll be able to access, and that's how they'll get health care. So in Mombasa, we will be doing that. We'll be launching that registration of those people, and I think that's a big thing. The final part of UHC that I would like to emphasize on is that universal health coverage is not just a government-led initiative. And I think it is important for Kenyans to know that every Kenyan has a role to play in making UHC work. And the biggest role we have to play as individual Kenyans, is essentially prevention. To make sure that in the first place, you don't need hospitalization and you don't get sick. That's the first thing. And how do we do that as individuals? First, we have discovered over this period is good hygiene.
Yes.
Hygiene and cleanliness should be a national movement. We have seen very clearly, it has been established very well, statistically, we know that a clean nation is one that is also going to save a lot of money in the area of healthcare. So long before you need access to health, what you should be trying to do is to avoid to go there in the first place. Diet, cleanliness, taking measures which are announced by the government when there's an epidemic, such as COVID-19, the masks, all the measures that we take. So the individual Kenyan has a very important role to play in ensuring that UHC works. Because preventing something from happening, preventing people from getting sick, is also part of universal health coverage. Because the way the people think at serikali, serikali fanyia hii, serikali fanyia hiyo, serikali haiwezi kufagia nyumba yako. You know? Yes. Serikali haiwezi kuja kufagia nyumba yako. Serikali haiwezi kukuambia usikunywe pombe. Serikali inajenga hospitali. Yes. Lakini serikali haikuambii kibia sana uwe mgonjwa uende hospitali.
Very true.
You know, serikali inataka kusaidia wewe usiende hospitali. Yes. Lakini ikiwa ni lazima ufike hospitali, basi serikali inasema ni vizuri utibiwe vizuri.
Ni kweli.
Lakini hiyo ingine yote ya kusema serikali lazima ijenge hii, ndio serikali itajenga. Lakini wewe unataka kwenda hospitali. Unajenga hospitali, unasema hospitali ijengwe kwa sababu wewe unatarajia sana kwenda hospitali. Hapana, unataka hospitali ijengwe. Yes. Ndio kwa bahati mbaya ukishikwa na ugonjwa unaweza kutibiwa hospitali. Lakini ile njia mzuri ya kukaa na afya mzuri ni wewe mwenyewe kujichunga na kujilinda. Yes.
Okay, from that candid conversation we've just had with the Health Cabinet Secretary Mutahi Kagwe Waziri, thank you so much for making time for that.
Yeah, most welcome.
Asante sana. And of course, we do hope that you understand now what universal health coverage is all about. Waziri has just painted a picture for us what it's actually about. And of course, don't go too far. We'll be also talking to the Principal Secretary, that is Susan Mochache. When it comes to the expenditure, how is the ministry prepared to handle that? See you until then.
Linda familia na marafiki dhidi ya magonjwa.